Hi guys, welcome back to my channel. How are you all doing? I hope you are doing great. I hope you've been doing great wherever you are. So today I'm bringing to you another juicy topic. So today I'll be talking about how to answer nursing and midwifery council exam questions in order to pass in one sitting. No, I'm not trying to say that if you don't follow this procedure that you're not going to pass, okay? And I am not trying to say that if you follow this procedure and you don't know what you're writing that you're going to pass. But this method, this thing I'm trying to say now is tested and trusted. These tips I'm going to give you now is tested and trusted. That is what I've been using. That is what I used all through my stay in the university studying nursing. And during my nursing and midwifery council exam, I used it as well, and I felt it would be good if I share it on my channel. So a part 2 of a video I've already made before, how to pass nursing and midwifery council exam in one sitting. So this is also a continuation of it. So if you're interested, mind you, this tip can also help you even if you're not studying nursing. It can also help you in your internal exams, in any exams that you may go for while in the university. So if you're interested in this kind of video, keep watching. My name is Nkiruka Bennett, and you're welcome back to my channel. Okay, I have few things written out that I'm going to talk about. They are the most important things. The most important things, but there are important things that we should keep in mind while going in for nursing and midwifery council exam. So the first thing is answer questions with higher marks. Answer questions that has higher marks. Like if you've sat for this exam before, nursing and midwifery council of Nigeria exam. I'm a nurse and I graduated from a Nigerian university. So what I'm talking about now is mainly what is seen in Nigerian schools, in nursing department in Nigerian schools. So the questions come with answers with marks attached to the questions. Nursing and midwifery council of Nigeria are so kind that they attach marks to the questions, so that as you're answering, you know the one to answer first or the one to dwell in. So for example, you may see a question that have something like answers so question, write nursing care plan of a patient with so kind of disease condition, and you see beside it they write 9 marks. Then write the pathophysiology of heart failure, beside it they write 9 marks. Then they ask another question, general nursing management of so disease, you write 9 marks. And you go to number 3 question, you may see something like, with a well-applied diagram, draw the describe the anatomy of the heart, and you see bracket 1 mark. So my dear, it is obvious that you don't have to dwell on those questions with few marks. Okay, pour out everything you have on those questions with higher marks. For me, if I want to advise you, when you see those questions and you know that that one that has the highest mark, you know it very well, use that time that it is fresh in your brain. Use that one as your number 1. Start with that one. Write number 3. Write 3 in front of your question answer sheet and start answering that number 3 that you know. Use it as your first question that you're going to answer. Answer it very well, but it doesn't mean that you're not going to answer the other questions with fewer marks. Okay, but those ones that has higher marks, pour in more effort. But those ones with the lower marks, pour in effort, but make sure you don't waste all your time answering those questions. And by the end of the day, when you are answering the one with the higher mark, the examiners must have said saying, time to pass your paper, 5 minutes more, and you end up rushing to answer those questions with heavy marks, it will really affect your score. So secondly is diagrams. When it comes to diagram, most in nursing council exams, even if you don't see it, even if you are not asked to make a diagram in paper 1, in paper 2 you may likely make a drawing. Yes, because you hardly write nursing and midwifery council exam without drawing something. So, and you have to learn all the drawings that you know in nursing, so while reading your anatomy. So if they ask you, and most times those drawings have 1 mark attached to it, just 1 mark. So they'll say, with a large labeled diagram, describe the anatomy of the human heart. Do not waste your time painting the human heart, trying to make the heart look so beautiful. At the end of the day, it's just 1 mark they're going to give to you. So do not waste your time drawing for, God knows when, for hours. How to draw the heart, for example, draw it as fast as possible. Do your labelings. If you don't remember most of the labelings, make sure you write the important ones, or the ones you remember, and make sure you don't put less than 5 labelings. At least if you draw something neat and good, then you label, then you go into description. You don't have to waste the whole time, though. In as much as one question is important, one mark is important, it can make you to fail, it can make you to pass an exam. So, but don't joke with it, but do not waste the whole time you have trying to make a diagram look so beautiful. Nobody is going to award you 100 marks for drawing the heart to look so beautiful, like a professional artist, man. So, but then another thing is, they said with a large labeled diagram, some people will go and draw. This is a sheet of paper. Some people will go and draw something from here to here, one tiny diagram here. My dear, you're making a big mistake. Look at here, I've marked here. At least your drawing should cover 1/3 of your answer sheet. A large labeled diagram, it should be large enough, then you label it. So I can show you again. The drawing should cover from here to here, at least 1/3 of your answer sheet. Then you label it very well, then you describe. And at the end of the day, after drawing, make sure you write the name of what you've drawn. For just write out a heading describing, showing the words you've drawn. Okay, you can write you can just write the anatomy of the human heart. Okay, if you write in capital letter, do not underline. If you write in small letter, you underline to show that this is what you've drawn. Don't just draw it and assume that the examiner know that you drew a heart. You have to give it a heading that you've drawn the heart. Okay, write a heading for each question, for each answer. So if they ask you to describe a drug, for example, to write about a drug, for example paracetamol, so in your answer sheet you have to write paracetamol as a heading, underline it, then below it you start answering that paracetamol belongs to the group of drugs known as analgesics, and you now start giving the indications, like, and so on and so forth. Make sure you give a heading of what you are going to answer. Don't assume that your examiner knows that it is paracetamol that you are writing about in number 2 question. Okay, if they ask you to write on the nursing care plan for a patient with congestive cardiac failure, before you start answering the question, maybe it's number 1 question, just write, when you write number 1, you just write nursing care plan for a patient with congestive cardiac failure. You underline it, then start answering. Make sure you have a heading for any answer you want to write. Okay, don't just start writing. If they ask you the pathophysiology of, discuss the pathophysiology of right-sided heart failure, don't just come and say right-sided heart failure is so and so and so. First of all, if the question is number 2B. You write number 2B, then you make a heading: the pathophysiology of right-sided heart failure. You underline it. If you write in capital, don't underline. If you write in small letter, underline it. Then below it, you now start describing the pathophysiology of right-sided heart failure. Know the terms used in examination. It's not only in National Midwifery Council exam, even in your internal exams. There are terms that are used in exams which you should know, because most times some people know the answer but they didn't understand the question. So you have to read the question very well, understand it very well before you start answering. So for example, they say enumerate the types of something. Enumerate means list. Just list it out and leave it. Do not explain. They will ask you list and explain, or enumerate and explain. Then you list. After listing them, if they are up to 5, you list them 1, 2, 3, 4, 5. Write them out. Then below it, you now start explaining them one after the other. The first one, the second one, the third one, you describe. But if they say list, only list and do not explain. Do not do pass yourself, okay? Notes means write everything you know about it. When they say, for example, I'm just using the heart, that's what is in my head right now. I'm sorry, I'm using only the heart. Okay, they say write short notes on the urinary system. So it means write everything you know about the urinary system, but summarize everything you know about it, but in summary. That's the meaning of write short notes. Don't just go and define it though. Okay, don't just go and start giving a definition, then you stop. No, after giving a definition, you give the types, give the components, and describe some things under the components. That's how to write short notes. So I think I've exhausted what I wrote down to talk about. So if there is any other thing that I didn't remember, you can let me know in the comment section so that I can make a video about it. If you have any video, if you have any question in nursing that you want me to talk about, please, you can let me know on the comment section so I can make a video on it. If you have any private question you want to ask me, you can ask me on you can send me a direct message on Instagram. I have my Instagram name on my description box, so you can check it out there. Follow me on Instagram. You can ask me direct questions. If you have any question you can ask me publicly here, you can put it down on the comment section. And if you've not subscribed to my channel, what are you waiting for? Subscribe now. So please, if you've not subscribed, please subscribe to my channel. Click on the subscribe button, the red button. It is absolutely free of charge, and turn on the post notification to get notified each time I upload videos like this. So if you don't subscribe and turn on the notification, you will know when I upload new videos. So that's why it's important for you to subscribe. So guys, and I have another topic coming up in my next video. That's how to answer questions that you don't know in Nursing and Midwifery Council exam, because the idea is you don't leave any stone unturned. You have to answer all the questions if you want to pass, because if you leave any question unanswered, it can affect your mark. So you try as much as possible to answer. That is one of my secrets in the nursing school. I don't leave any question unanswered. Even if I don't know the answer, I must answer the question. I have idea to everything. So my next topic will be how to answer questions that you don't know in Nursing and Midwifery Council exam. So wait for that video. So if you enjoyed this video, please give it a thumbs up. You can click on the like button. That's what I mean by give it a thumbs up. Like, and also you can share with your friends. Subscribe to my channel, and I would like to hear your comments in the comment section. Tell me if you have your own tip on how to answer a Nursing and Midwifery Council exam. If you are already a nursing graduate, you can let me know in the comment section. Okay, so thank you so much guys for watching. It's already getting dark here, so I need to end this video now, because before this place is covered with darkness. Okay, thank you so much guys for watching, and see you in my next video. Bye bye.